Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. This evening, as a build up to our upcoming boot camp in multiple pregnancy, I wanted to share with us a couple of medical marvels, a couple of things that can happen to some women who never give up. So I have a client a few years ago during the COVID. Before then, she had 7 years of difficult primary infertility. Remember that we have different types of infertility. Primary infertility happens when you have not been pregnant ever in your life. Now, this lady had 7 years of primary infertility prior to the COVID, but she eventually succeeded in becoming pregnant naturally of twins, twin girls. Okay, so I'm going to tell us what happened subsequently. Now, within the period of COVID, when she understood that stress can actually affect her chances of becoming pregnant, you see, stress is not your friend. So when you're stressing, when you're freaking out, you might not do the basic things you're supposed to do. So there are a couple of women that actually don't have infertility. They are not just practicing PPP. So if you notice, our group runs on PPP. And for some time, we've been preaching this. It's become like a national anthem. But unfortunately, some people are still not practicing PPP the right way. You can practice PPP passively. You pretend you're practicing, but you're not practicing. You have to be religious about your PPP. And this is exactly the only weapon that this lady used to defeat infertility. You see, when you defeat infertility, infertility is going to let you be. God will meet you halfway, and God has a way of giving you jara. So in my language, jara means extra. So this lady got pregnant just because of the COVID restrictions. The husband was together with her, and they were making love consistently, 48 hourly. They were praying and they were practicing. They were actually consulting with me within this period. So what happened? She became pregnant naturally after 7 years of infertility, primary infertility, which is more difficult to treat. Now, God so kind, she had her twin girls, no problems. Now, she did something that personally I don't normally subscribe to. You see, every baby must be planned for, right? So before you go home after delivery, please discuss contraceptive. For some reason, when you have long-term infertility, sometimes you might think you're invisible. They didn't practice their contraceptive and she became pregnant again, luckily expecting triplets. Now, I'm excited that she will be expecting triplets in 2022. But my people, she became pregnant in 2020. She had a baby in 2021. Now she's gone for the scan and they saw 2 sacs, possibly 3 sacs when you go for your scan. When we see scan, the number of sacs and the number of poles we see will tell us the number of babies we might be expecting. Am I happy about that? Well, personally, I love babies and I also love women. And I want the babies and the mothers to be good. But we need to be careful. You see, when I tell stuff about what I know, I'm telling you from experience. We all want to have babies, but please plan ahead. Be mindful, be careful, be proactive. Now, this lady has not rested. Multiple pregnancy is a complicated pregnancy. Normally, a woman is not supposed to have more than one baby in her womb. So multiple pregnancy is actually a good abnormality. No, she hasn't recovered because she had CS. She hasn't recovered from that particular delivery. The babies are not even up to 1 year. And she went and continued making love with her partner and she became pregnant again. Now think about that. From 7 years of no babies to probably having 5 babies or 4 babies, worst case scenario, within a space of 2 years. That's a toll on the lady. That's a lot of burden on the lady. So we need to be careful. I understand you want to start your family. I understand you want to have twins. I understand you want to have triplets and all that. Guess what? Any woman, anytime can conceive and have twins, especially identical twins. Any woman can spontaneously have identical twins. Now, there are a couple of factors you might not even know it runs in your family. It might be your great grandmother or whatever from your mother's side, because twinning is a maternally determined trait. Now, no matter the type of infertility you have, God can open doors for you. So suddenly a lady that didn't have a chance, twin girls, identical twin girls, and she's expecting triplets. My only problem, I would have wanted that she waited for 18 months, that she recovered, that she looked after her twins before becoming pregnant again. It takes a lot to be pregnant. It takes a lot to be a mother. Now, my advice to this lady, it's done, it's done. Okay? Now, what you need to do acutely, if you want, I want you to get a subscription, a 6 months. For now, that's our maximum subscription. Get a 6 months plan. Make sure you are assigned to me. Immediately be very committed to your ANC. Find help. You definitely need help with your little twins and in this pregnancy. So I hope your husband is helping. I hope your mom is still around, or your husband's mom or your auntie. You need help with your, neonates. Then you need help in this pregnancy. So please get that help. Now, please be careful. It is what it is. You're going to have your babies by the grace of God, but I hope that after this, you be careful and more proactive. So you're going to start your ANC on time. Make sure you take all your ANC medications. Make sure you go for all your ANC appointments. Make sure you're very mindful of what enters your body. Make sure you're still exercising. Eat good food, sleep. I don't know how you're going to achieve all this with little babies, because, we all want babies, but the truth is that babies change everything, including your sleep. I remember I used to sleep a lot before Zara and Dumeja came. So lately, even as they are all, Zara is 11 and Dumeja is 5, sometimes sleep is just no sleep. Because of that fatherly, motherly instincts, you want to keep an eagle eye on your baby. So I'm happy, but at the same time, I'm a little bit worried, but I believe that with God and good doctors and good care and being careful and mindful and having a helpful partner, you will succeed in having your triplets by the grace of God. But please, be careful. So I wanted to share this good news. Something that is good should be good. We are all expected to be mothers and fathers, and that's exactly who we're going to be. Nobody can stop that. Okay, so I wanted to share this story to encourage someone out there. It's possible you're shopping for money for IVF. You probably don't have the millions, but you've given up on your lovemaking without knowing that lovemaking can actually still get you pregnant. It's possible they gave you a diagnosis of blocked tube, and probably the blocked tube might be mild blockage, and you go for your HSG and it opens the tube. Maybe they gave you a diagnosis of low sperm count, and it's just a one-time test. So you can't just use a one-time test to write yourself up. So the point I'm making is, regardless of your diagnosis, keep on making love with your partner. Keep on praying to God, then get help. The earlier you get help, the better. Some people might have a need to do things they might not be comfortable with, things they might not understand. But when you ask God to show you the way, God will show you the right people that will help you. So please, let's keep on keeping on. Enjoy the rest of your evening. I hope you registered for the boot camp. Multiple pregnancy boot camp is a class we normally teach once in a year. You don't want to miss the 2022 version. We have a subject matter specialist. We're going to talk about the cutting edge trends in making babies, multiple pregnancy, natural, artificial, and what have you. So make sure you register. It's going to be on the 27th by 9 p.m. Nigerian time. When you are registering, make sure your partner is in attendance. Your partner must be in attendance. It takes two to tango. Thank you so much for supporting SGHS. My prayer is, as you continue to pray, as you continue to play, and as you continue to practice, God will attend your party with your baby boys, baby girls, twins, triplets, and quadruplets. Enjoy your evening, and bye-bye for now.